All right. Thank you everyone for joining our snack size webinar on eating for good sleep. This week we are celebrating RTX Better Sleep Day on the 14th, recognizing that many of us may have lost an hour of sleep on Saturday night. And for those of us who don't participate in daylight savings time, I know I had to lose an hour of sleep because I had a business trip and I was traveling through time zones. So it's a good time to remember to prioritize our sleep. I am Andy Peck, Global Health Promotion Manager for RTX, and it is my pleasure to introduce Janelle Finnerty, the Regional Director of Wellness for Eurus Dining, and she is going to take us through our snack size webinar. Janelle, I'll pass it to you.
Thank you for that introduction, Andy. Welcome everyone to the Eat for Better Sleep webinar. How what you eat really does impact how you sleep. We'll learn how eating habits impact your sleep and better understand why what you eat is affecting sleep. As Andy mentioned, my name is Janelle Finnerty. I'm a registered and licensed dietitian nutritionist, a professional chef, and the Regional Wellness Director for Eurus National Accounts supporting the RTX contract within Compass Group. I have experience as a dietitian in clinical, outpatient, and private practice settings, as well as teaching professional development programs for food service teams K through 12 setting. I enjoy presenting webinars, lectures. My favorite is cooking demos on numerous health topics. So today, my hope is that we can have a deeper appreciation for sleep. And we definitely know, as Andy was mentioning, when you lose even just a little, you can really feel it the next day. But we'll hopefully unpack and understand better just how our choices, both eating and lifestyle, during the day impact how we sleep in the evening. So we'll uncover some facts about sleep studies and research, understand better how a lack of sleep is a great risk to our overall health and well-being, why good sleep matters for health and longevity, which diets are considered best for better sleep, what is sleep hygiene, foods and nutrients that are recommended for good sleep, and a few key takeaways. And then we'll close with a few questions. So before we begin, I want to express that this webinar should not substitute for speaking to your healthcare provider. If you regularly have problems sleeping or notice signs or symptoms of common sleep disorders, please consult your healthcare provider. Your provider can run tests, including sleep studies, to tell if you have a sleep disorder. I first wanted to review some interesting facts and data about sleep. So this may be familiar to many of you, but the average adult needs 7 to 9 hours of sleep a night. But digging a little deeper, did you know that we actually cycle through 4 to 6 different cycles a night? The average sleep cycle, one sleep cycle is about 90 minutes. So when you do the math of 90 minutes with an average of 4 to 6 cycles, it really does ballpark you right into that 7 to 9 hour range of required sleep. So what is happening when we sleep? It's pretty fascinating. There are many stages of sleep. I think a lot of us have heard about rapid eye movement, which is generally called REM. It's about a quarter of our total sleep, and it involves intense brain activity. This is a stage where we dream. Dreams occur here. In fact, the average adult does dream about 2 hours a night. But you will also, during REM, your brain will be encoding, it'll be learning, there'll be memory, concentration. It improves mood regulation. We review our emotions during this stage and process through memories and even fear. A lot of good things. It's going to go through the central nervous system and help repair that as well. In terms of non-rapid eye movement, this is where our body just kind of slows down. So blood pressure drops a bit, heart rate will slow. It's considered the deepest stage of non-REM. In fact, the deep sleep, often called slow wave sleep, is the most critical stage. So much is involved here. There's tissue repair and growth. The body really is clearing out the old and building and creating and regenerating new cells and repairing the tissue. It clears out toxins from the brain. I think that's just fascinating. It helps strengthen memory. It's supporting your immune system, really healing, growing. So overall, it's a very restorative process for our body and our brain. You might be thinking to yourself, okay, like, how's my sleep? But then overall, how are we all doing? And if we look at Americans to consolidate that group, we'll look at US. More than 1/3 of US adults report not getting quite 7 hours of sleep a night. 42% report feeling sleepy during the day at least several times a week. And 50 to 70 million Americans do experience sleep disorders. And sleep disorders include insomnia, sleep apnea, and even restless leg disorder. 2/3 of adults occasionally experience insomnia, with 10 to 15% experiencing chronic insomnia. When we look at women compared to men, women are more likely compared to men, 40% more likely to experience insomnia. And I do think that this has to do with hormone fluctuations throughout our life cycle. PMS can increase insomnia by 2 times. Perimenopause women experience more insomnia. And menopausal women, even more, 35 to 60. So over half of menopausal women will experience insomnia. Again, mostly in part due to those hormone fluctuations and changes. When we look at older adults, we know that it's reported they do experience significantly more sleep disorders. So as we age, and if anyone reports living with physical or psychiatric disorders, that number increases. So those conditions will increase the likeliness of sleep disorders. Chronic sleep disorders, such as obstructive sleep apnea, known as OSA, 1 billion adults worldwide experience this. And sadly, 80 to 90% of cases are undiagnosed. And I say sadly because OSA can put someone at great risk for serious health problems such as heart disease, stroke, diabetes. It can lead to daytime fatigue, memory problems, and difficulty concentrating. And the consistent overconsumption of calories is often a leading factor. It's the strongest predictor for OSA. So weight gain, even a little, so 10%. So if someone is 160 pounds, 16 pounds can put someone at a 6-time increase for OSA. So it's really important to have an annual physical and check in with, our body weight as we age too. So, and what is it that excess body weight is doing? It's really putting additional pressure on the diaphragm and lungs. And this leads to narrowing of the airway. And if fat accumulates around the neck and throat, it's a great risk. So super important to not take sleeping issues lightly. We definitely want to get them checked out. So common sleep disruptors, these are things that lead to broken sleep and decreased deep sleep. And again, that's that really critical stage. So very important to try and, as much as we can, eliminate disruptors. Such common disruptors are known like caffeine and alcohol consumption. I will be talking more in depth about that later in this webinar. But pain is often, no surprise that pain is on this list, but it does contribute to sleep loss. Hormonal fluctuations. And I did describe that earlier. But watching TV and social media is a big one. In fact, did you know most people do note the #1 top bedtime activity is watching TV? In fact, 50% of people that are watching TV do report getting less than 7 hours of sleep a night. So it's just really good to think about the things that might be on our own personal sleep disruptor list and see what can we modify. It may not be all or nothing, but maybe, work towards perhaps less screen time. Social media use is another big one. And I put these two graphs up here because I found them so interesting. In fact, YouTube comes in as the top social media platform that people were scrolling on. 74% surveyed by Sleep Foundation reported YouTube was their place to go. So, it's just, again, thinking about our own side of the fence and what we have control over. Maybe those are places where we put it in a different part of the day. But it was pretty shocking for me to learn that over 3.5 hours are spent scrolling on different platforms for the average adult. And then on the left-hand side, which social media platform causes the most anxiety? I found this very interesting as well. And Facebook, by and large, gets the majority of that. So maybe Facebook isn't the place to go instead of YouTube either. So it just, again, this may not be affecting you personally, but a lot of people are reporting, sleep issues, and we do know that scrolling is a common sleep disruptor. So important information and just something for us to note. So sleep deprivation does contribute to a lot of chronic issues that we experience, such as heart disease, type 2 diabetes, and mood disorders. It also contributes to poor regulation of hormones that help control weight through appetite and hunger, altering the signals you receive, which may result in an increase in hunger, which can thus cause weight gain by eating more, because those altered signals of our appetite and hunger are getting skewed due to lack of sleep. So that's just a great thing to check in on. Lack of sleep over time, in fact, can contribute to a shorter lifespan. Studies show people who get the recommended 7 to 9 hours of sleep per night do live longer than those who don't. But lack of sleep is also going to put us at greater risk of fatigue-related mistakes that can jeopardize safety. In fact, one study estimated the annual cost of workplace errors and accidents linked to insomnia to be over $31 billion. So it's quite a widespread issue. Other ways that lack of sleep can also report great problems is on the road with drowsy driving. Every hour someone is killed related to drowsy driving. In fact, over 6,000 fatal injuries on our highways per year are due to drowsy driving. So definitely lack of sleep can be a major disruptor. So we want to look at some of these, thinking about how can we modify things to improve our sleep. And on the next slide, I'm going to talk about just what you can reap with better sleep, what one can reap with better sleep. Physical health, definitely. We're going to see improvements here. It lowers your risk for chronic conditions like diabetes, heart disease, improving your heart health and metabolism, helping you maintain a healthier weight. It helps you regulate your blood pressure, and even improve immunity, helping to protect you from getting sick less often. Mental health, great gains here. It helps you reduce stress and improve mood, helps you to get along better with people. It helps you make good decisions and avoid injuries. So great for brain health. It's like golden medicine. It helps you to think more clearly, improves attention and memory, helps you to form long-term memories, and it helps us to do better at work, at school. It really helps your brain remove toxins that build up while we're awake. So when we are resting at night, our body is busy removing all those unnecessary cells and toxins, and really goes through a clean phase. In fact, in a study published in the Journal of Obesity, researchers tested 15 healthy young men of normal weight, making them try 2 separate diets for a week. So initially they were screened for sleep habits, all of which were normal and within range, so they were getting 7 to 9 hours a night. But after this, the researchers conducted a randomized trial in which the participants were given 2 separate diets. One contained a higher amount of sugar, saturated fat, processed food, and the second was healthier diet. It was much lower in fat and sugar and contained no processed foods. However, note the number of calories in both diets were the same and adjusted to everyone's daily requirements. What they saw was the deep sleep exhibited less slow wave activity when the participants ate junk food compared to those who consumed healthier food. So there was less slow wave activity in that deep sleep. That's where you're removing toxins, encoding so much, repair and regrowth, and super important. So processed food can really interrupt deep sleep. So even though they slept the same amount and both recorded deep sleep, the participants on the unhealthy diet had shallower deep sleep and therefore were not as rested the next day as those on the healthier diet. So this research demonstrates that unhealthy eating can be sabotaging your sleep quality, which is just as important as sleep quantity. So you might be wondering, is there a diet that I should be on for promoting better sleep? Well, it turns out we have a lot of studies. Scores of evidence-based research and studies do show that a Mediterranean diet is good for the health of your heart and brain, as well as dietary approaches to stop hypertension, commonly referred to as DASH. So both of these diets are recommended for helping us with sleep duration and overall sleep quality. So researchers found that the Mediterranean diet is linked to better sleep quality, improved sleep efficiency, and reduced time it just takes to fall asleep. It lowers the risk of insomnia, sleep apnea, and dementia. And the Mediterranean diet is thought to promote sleep by providing a rich source of antioxidants, vitamins, healthy fats. They're all found in the Mediterranean diet. So from fruits, vegetables, fish, olive oil. This is it's known as an anti-inflammation diet. So it helps reduce inflammation in the body. It supports a healthy nervous system function and potentially lowers stress levels. So this all contributes to better sleep quality. Additionally, some foods within the Mediterranean diet, like fatty fish and tart cherries, are naturally high in nutrients like melatonin and vitamin D, and these are also linked to improved sleep regulation. So now that we know a Mediterranean style diet is really beneficial for sleep, let's review another really healthy diet pattern, as mentioned earlier, the DASH diet. The DASH diet can help improve sleep by promoting a balanced intake of nutrients like fiber, potassium, magnesium, and calcium, all minerals very important for regulating sleep cycles. They also help relax muscles and reduce stress. So this all, again, just like the Mediterranean diet, contributes to better sleep quality. They're very similar diet patterns, in fact. The DASH diet is a little bit more in tune to reducing sodium and increasing those minerals I just mentioned, like calcium, magnesium, and potassium, because those help to control blood pressure. So it by the way, also keep in mind, it lowers consumption of processed foods, all of which have a lot of sodium and sugar. So those things do disrupt sleep patterns. But just key points about the DASH diet. So reducing the sodium intake, that will help to regulate blood pressure, but that, keep in mind, can positively impact that sleep quality. But it's really highly, highly recommended for people with sleep apnea. So if you're struggling with sleep apnea, you might want to turn to the DASH diet, and you can find tons of information online. Just put in capital letters DASH, and you will find, supported by the government, a lot of research and easy to follow diets that you can get or download easy. But also super important to note that it does help with blood sugar stability. Really, truly, all chronic diseases really go back to cellular metabolism, and anything that controls our insulin levels is going to improve our cellular response and metabolism. And this is noted here too. So, it focuses on whole grains. That's going to help with the fiber, maintain stable blood sugar levels. That actually prevents energy crashes that we don't even realize we're having during our sleep. And I'll talk a little bit more about that later. And keep in mind, again, those magnesium, calcium, potassium minerals are really critical for muscle relaxation, and they promote better sleep onset, meaning we can fall asleep a little faster. So what are the things kind of in our control that help put us in a place where maybe we can get into a better sleep pattern and have more refreshing sleep? So number one, developing a bedtime routine. So sleep hygiene, what is it? It refers to the practices and habits that promote quality sleep. So let's look at a set of healthy behaviors and environmental factors that contribute to this restful and restorative sleep. So routine in getting ready for bed. That bedtime routine is a set of activities you perform in the same order, approximately, every night in the 30 to 60 minutes before bed. So really important to disengage from screens. Avoid eating 3 hours before bed. That's actually pretty important. If you're digesting while you're trying to sleep, so if you have a late, maybe full dinner right before you go to bed, or even an hour before you fall asleep, while you're sleeping, your body's trying to process and digest. It can actually cause a spike in your blood sugar, which actually, without you realizing it, leaves you tossing and turning. And as your glucose levels try to stabilize, it can lead to disruptions in your sleep cycle. So, just something to keep in mind. Don't stress about being perfect when no one's perfect, right? Life's about balance. So, there are plenty of times where I have a late meal because that's the only time I could get it in. And I know I'll toss and turn if I don't eat, but just, I'll think twice maybe about what I'm having. I'll avoid fatty, sweet, salty things because I know that's probably going to show up in my sleep. I really will not sleep great when I have those types of foods. So, keeping that in mind. But in terms of alcohol, I definitely want to touch base with that because a lot of people think it's a sedative, that it's beneficial for helping you get to sleep. And actually that's kind of true. It does have a sedative quality to it. It can help you to fall asleep and get to sleep a little quicker, but it is not going to be your friend once you fall asleep because it is known to disrupt sleep patterns because it shortens the amount of REM or rapid eye movement sleep. So sleep in the first part of the night is where it's distorting your sleep, and that can lead to more night awakenings. So, definitely more of a fitful night with alcohol. Caffeine, some people can tolerate a great amount of caffeine. It won't affect them, but I know plenty of people that have to cut off caffeine well before 3 hours, more like 6 hours. And I am a little sensitive to it, so I know that I cut it off around noon. So learning what you can tolerate is, really important when it comes to caffeine, but it will block the hormone adenosine. So that promotes sleepiness. So, bearing in mind, our body does go through a lot of processes, and caffeine will block some of those hormonal beneficial things too. Light exposure is important, type of noise and volume, also important. And very important in a lot of research was maintaining consistent bedtime and wake time. So that's something to lean into if you're all over the place with when you go to sleep and when you wake up. And of course, creating a comfortable and relaxing environment. So many foods do contain nutrients, chemicals, and other compounds that help control the body's sleep cycle. So what nutrients promote sleep? And there are some. Studies show that some nutrients in food are very important for the sleep cycle, but keep in mind potential benefits of sleep promoting foods. Try to give yourself a little window of time to digest, because if not, that could leave us with acid reflux or indigestion. That's not meant to help our sleep. So Um, Talking a little bit about these nutrients like tryptophan, it's an amino acid precursor. It actually helps to induce sleep, as it's that precursor for two very important sleep hormones, serotonin and melatonin. Tryptophan is present in small amounts in protein foods, and it's actually quite high in yogurt, milk, oats, bananas, poultry, and other things. But those are just some of the ones that I wanted to mention. Melatonin, it's found in dairy and cherries. It makes you sleepy. And it's also kiwi is a great source of melatonin too. Who would have known? Um, but potassium is found in bananas, magnesium, also bananas and almonds, and these all help promote muscle relaxation. So those are great. And shout out to tart cherry juice. You can buy bottles of tart cherry juice everywhere. Actually, you probably never noticed it, but Walmart, Target, Whole Foods, a lot of grocery stores. I go for the organic one, but you can have a cup of that probably a few hours before you want to go to sleep, because it is a bit acidic, so it may not be well tolerated by everyone. It's just something to experiment with. But I do want to talk a little about the importance of B vitamins for sleep quality. They help regulate that rhythm and the sleep cycles. B6 is very crucial for synthesis of the serotonin. So that neurotransmitter is crucial for mood and sleep regulation. Whereas B12, they're all part of the B complex, that's involved in melatonin production. And that can directly influence the sleep-wake cycle. So anyone that's experimenting maybe with a vegetarian diet, or certainly anyone that is practicing a vegan lifestyle, you definitely want to check in with your healthcare professional and see if you might need supplementation. Deficiencies in B vitamins, and especially B6 and B12, lead to sleep disturbances because of that disrupted neurotransmitter production. So think about that. You definitely want to promote that great sleep architecture by making sure you can check those boxes with the B vitamins. Also, low protein diets are reported to be associated with poor sleep quality. So overall, getting a good balance of protein foods, but salmon, oysters, turkey, low-fat dairy, they're great for helping with tryptophan. And vegetables and fruits, and as mentioned, those tart cherries and kiwis are awesome, and nuts and seeds and whole grains. I think every time I do a webinar, I'm going to say eat a rainbow. So very important. It helps with so many functions in the body. And the easiest thing, just look at your plate and try to put more colors. Those phytochemicals work hard. They are pathway cofactors in so many of our systems. So trying to get those in is super important. And I just want to say, before you reach for something like this to get through your day, consider how your daily food choices and habits affect your sleep. And let's consider our review points. So going to bed and waking at the same time every day is critical. That room should be cool and quiet and limiting in stimuli. Turn off your electronics 30 minutes before bed. They need to go to bed before you go to bed. Avoid heavy meals and alcohol before bed, avoiding caffeine in the afternoon and evening. Trying to maintain a healthy weight and exercise often is very beneficial. Aiming for balanced meals and trying to get that last meal in 3 hours before bed. I put protein in around 30 grams plus or minus. Some people, as we age, we actually need more protein, turns out. So avoiding late night sugary, salty foods too, very important. And when it comes to protein, I just want to say keeping it lean and mean, so important, because we don't want to be doing the fatty, salty kinds of protein options. So with that, I want to thank you so much for your time and attention today. Please feel free to reach out to me anytime if you have questions